We have Dr. Bob Rishiraj joining us on the show again. Welcome back. Happy New Year, Dr. Rishiraj. I haven't seen you since before Christmas.
Happy New Year to you and our viewers.
Thank you very much. Today we're talking about bone grafting and how that relates to implants. Maybe just talk a little bit, first of all, about what a bone graft really is.
So bone graft is a material that is put into an extraction site where a tooth has been extracted, or teeth were extracted before and we need to build the ridge up. Ridge is the jawbone itself. In order for implants to be stable, they must be surrounded by bone. We are constantly fighting that battle when it comes to surgery of an area where we have extracted a tooth or going to extract a tooth. So in order to put an implant in, we have to have height of bone and width of bone. In order for bone to be placed, or in order for an implant to be placed. So it is critical that we maintain or build the bone up to allow for an implant to be placed.
Where would you harvest this bone from, or where would the bone come from for these grafts, Dr. Rishiraj?
So the bone, there's four types of bone that we can get. One is we take it from a person themselves. So we call it autogenous bone. So we harvest it from one site. Sometimes we even use a hip if it's a large area that we have to build up. We can use someone else's bone. Typically it's taken from a cadaver where the bone is harvested, it is cleaned out, it is infected, and it is then gone through all the washing procedures and tested to make sure that we don't have any viruses or any other products in there. The third type is we can use cow bone and sometimes pig bone, but typically cow bone is used. And that fell out of favor a few years ago when we had mad cow disease. And people said, you know what, I don't want to use it. And I actually got away from it as well. I don't use it very often. The fourth is totally a synthetic product called tricalcium phosphate. There are many people that don't want anything to do with anyone else's bone. Plus, they don't want to have bone harvested from their cells because it's another area of surgery that protracts the amount of time of recovery. And so basically, if you end up using tricalcium phosphate, they're just minerals that have been put together and we put it into the extraction site, or we can build it up. And once that's built up, then you wait approximately 4 months, 4 to 6 months before the site is viable and usually ready to have an implant. We have a graphic here that maybe we can show everybody. What are we looking at here? This is an X-ray, and what exactly is the picture here, Dr. Rishiraj? Okay, so if we look to the right bottom side of that X-ray, you can see 4 little implants. They resemble tooth roots, but there are titanium alloy implants that were put in approximately 4 to 5 years ago in the patient. So that patient actually had a bridge. The bridge was lost because of cavities around the teeth, and we had to build that bone up. So if we look carefully where that bone level is, I don't have any way of pointing it out, but if you follow that white line on the jawbone, it carries right across where the implants are. And you can see that the implants are sitting at or just below the bone level, which allows the bone to actually integrate around the implant, making it very, very solid. It is actually more solid than teeth. Because teeth have a membrane, periodontal membrane, which gives the teeth a little bit of movement. Whereas when you have an implant, there is no movement at all.
Interesting.
So it is a very great concept that was started by Dr. Brannemark in the 60s, and it has worked out very, very well. But implants always work well when you have adequate bone. So bone grafting becomes very, very important, either at the time of when the tooth is extracted or at a later date. It is easier for us to bone graft at the time of surgery when the extraction is done, so that the bone that heals and matures allows that area to be stable in 4 to 6 months. Because when a tooth is extracted, the thing that most people don't know is that bone collapses on itself. By filling that site up with bone that we put in, it basically prevents that collapse of the jawbone locally, thus stabilizes the area, and 4 to 6 months after the bone graft is done, an implant can be placed, or implants can be placed.
Thank you so much, Dr. Rishiraj.
You're very welcome.
Lots of good information as always. For more information, or if you'd like to get a hold of Dr. Rishiraj at his office, there's the information there, the website and the phone number. We're back in a couple of minutes here on Midday with Farron Dufault from London Drugs, talking about protecting your skin from the sun.